Welcome everyone. We are very pleased to be today in a PENTAX Medical Center for Education. My name is Pawlak. I'm from Poland. I'm working in a hospital of the Ministry of Interior and Administration in Szczecin. I'm therapeutic endoscopist, and I have a pleasure to have my friend and excellent expert in hepatobiliary field, Jan Werner from Netherlands.
Thank you, Kasia. My pleasure to be here. My name is Jan Werner Poley. I'm a gastroenterologist specializing in pancreaticobiliary endoscopy and interventional endoscopy. And at present I work in Maastricht University Medical Center as head of endoscopy at the Department of Gastroenterology and Hepatology.
So we are trying to develop EUS training and to give opportunities to more people in Europe. So we have excellent already gastroenterologists and endoscopists here. And we are performing here a EUS training, which is incorporating lectures and also a hands-on training, which I feel is pretty important, not only when you're starting, but also when you're just already doing EUS. So I have a question to Jan. Yes. So what do you think about an EUS training and what's important in the structure and what are the basics, and if it's basic EUS, diagnostic EUS needed for EUS therapeutic procedures, because sometimes people feel that they can go ahead to therapeutic ones.
Okay, good points. I think in any field, training is important to become good at what you do. It is especially important, I feel, for EUS because it's you really need either good mentors or a lot of experience, or preferably both. And that can be hard to get. And what I like about this training setup with a relatively small number of participants and some expert faculty is that you can have a really nice interaction. The format enables participants to have a very low threshold to ask actually questions, to interact with the faculty. And that works from a training perspective, I think, much better than when you're in a large auditorium where people do all kinds of fancy stuff. And this is more about the basics. And I think that is where you start. You start off with the basics. And that's also true when you make your first steps in the field of interventional endosonography. You have to start off with the basics. And the basics for interventional endosonography is endosonography, yes, but also I think ERCP or ERCP skills. You need both, and that's hard to come by, to be proficient at both. But I think it's necessary, and courses like this are a step in the right direction to get you there.
So this is what we're doing today. So we have introduction to diagnostic EUS. So we have lectures on EUS basics, visualizing and improving our I would say abilities to then further target the lesions for therapeutic EUS. But also sometimes we struggle with that, especially when we don't have mentors in our centers. Mm-hmm. So what do you feel, what's the role of mentor in especially therapeutic EUS?
Oh, it's essential. I think we were discussing earlier, I did my first interventional EUS procedures only after having read about it and thought, well, maybe I could try that, and there was no help, and so that's the worst way to learn. Having a mentor close by or further out doesn't really matter, is of tremendous help, and that's also one of, I think, the key aspects of trainings like this, is that you can get in touch with people and ask them, consult them, maybe not in the room itself, but also about indications and pitfalls and things like that. So I think it can be very helpful. So
in the training, just to sum up, we have basics, so lectures and hands-on, so pretty structured training. Then we have incorporated mentors, right? Mm-hmm. But also we were discussing today about novelties and the role of, or the place of artificial intelligence for EUS. Yes. So some people are skeptical, some are very keen to do that and enthusiastic. So what do you think about that? What's your point?
I think that is a good question. It's an easy question to ask and a difficult one to answer. I think if you're honest, we do not know where this will end. I think that these are the first, possibly baby steps of a technique that will be I'm sure will be very important in the future. And but it's very hard to predict where it exactly will be important for. I think, like I said before, I would like AI at present to help me interpret the images I see when I do elasto or when I do contrast-enhanced ultrasonography. But for somebody else, it may be somewhere else. And it's hard to predict now, I think, in what area AI will be most helpful.
Excellent.
But I'm sure it will be important in the future.
At some point. But then still we need a good training and good mentors and eventually AI as a help.
For sure. And it will be some time before there's no human involved anymore in EUS or endoscopy in general. That's a long way away.
We hope not.
Yeah.
Okay. So thank you so much for this
You're welcome, Kasia.
talk. So we are very happy to be here and just to help people to start and continue the pathway in the EUS.